Well, good morning or good afternoon, everybody. We want to thank you very much for attending our session today, successfully delivering on healthcare IT projects and or delivering on new products in this industry. Obviously, we've had some interesting times going on, so I hope everybody is staying safe and being well wherever you're located around the world. My name is Greg Bailey. I'll be doing the presentation today. If you have any questions, feel free to ask them in the question or Q&A box and or raise your hand, and we will open up your mic and allow you to ask questions. So with that, obviously, we do a lot of events around the world. Absolutely every one of them have been canceled so far through August. So some of you, I was looking forward to meeting you at a couple of these events, but they all will be canceled. So I expect we'll be doing a lot of these web events in the near future. So with that, just want to let you know we have lots of customers that we've been talking to, both existing customers and new customers around the globe, both healthcare providers, both companies that are delivering products to the market, some of the leading ones in the world, such as Siemens, DSM, Stryker, and so on. So this is all based on real world experience that we're finding around the globe. So what we're going to talk about today is, in essence, really with all of the changes that are going on now, for those of you that are either delivering products to the healthcare organizations that are in the world, or you're now having to take a look at your current portfolio and modify that based on all the activity that's taken place under COVID-19 and with everybody kind of in a all hands on deck mentality. We're going to talk in particular about how it's important to be able to optimize the resource capacity, do the scenario modeling, and being able to innovate in this times that we've got going on here today. So when we look at, obviously, things that have changed dramatically, right? Everybody pretty much had a strategy that they were working towards. They were delivering products, they were delivering the projects. All of that's really been sort of flipped upside down in many cases. Now, a lot of the projects are going to continue going on, but there are many things that have either had to become new projects right away in terms of registering people, in terms of reallocating resources on the front lines, and or even from the back office perspective, having to change or modify projects that were taking place. So how quick and how easy is it now to be able to ask these kind of questions that you have to deal with now? In some cases it's easy, in other cases it's not so easy. So we're going to talk about some effective tools that'll make it much easier for you to be able to do this in your environment. Now, we're going to spend about 45 minutes in this session, so we won't go the entire hour, but we want you to know that if you have questions, we'll be on the line for whatever is needed. So when we look at the portfolio and the impact today, especially in the healthcare, right, there's a lot of obviously externality items that come up. Obviously, we're going into a big black swan event, geopolitical shocks that kind of change the challenge of the business. When we look at currently what are the products that are taking place, there's been a lot of modifications into either changing what we're delivering or reallocating resources to new projects that we're moving up in the pipeline. So when you look at your budget and or the resources, right? In some cases, the budgets are getting dramatic inflow now from the government. And in other cases, you're having to take a look at your current projects, put some of those on hold, and in many organizations too, right? You're dealing with, even in some cases, reduction of headcount because of the fact you've got certain people that are now out of work, either sick or, in many cases, they're having to not be able to get into the office and they're working remotely. So that's kind of maybe changed the way you've had to work. So, when we look at these kind of items, that's all going to have an impact on the portfolio that you're working on. So And why is everything so vulnerable, right? I don't even think I have to go into this with you, but when we look at the way demand has changed, and it's not only demand in healthcare, it's kind of it's unique versus some of the other businesses that we've been talking to, where their portfolio, has gone into a complete hold pattern, right? Some of the organizations we deal with in the oil and gas sector, right? It's like crashed. So they're quickly looking, how do I reduce my head count's going to be reduced, so then I can't deliver on that. In many cases in the healthcare sector, you're, trying to take the resources you've got, whether they're frontline workers or back office workers, and reallocate them on new missions to deliver, based on all the activities that are taking place around the world. So we're going to spend some time talking about this. And in many cases, the existing tools that we found the clients that we're working with have in place are just not good enough to allow them to quickly and be agile in determining what they're going to deliver on. So we are going to talk about a product, Tempest Resource, today. It is built specifically for this kind of an event that we're going through right now, which is allowing you to quickly and easily do these what-if scenario planning, reallocating resources, shifting priorities around in your portfolios, whether, again, it's in the IT arena or whether you're delivering and building things in the maintenance environment, whatever it is that you're doing, allowing you to be able to do that. So with that being said, we'll talk about how our clients are using Tempest Resource. Many of them are using it standalone, although I will tell you, we do have a lot of clients that are using Excel to kind of manage their resources in their portfolio. And then we have other clients that are leveraging PPM tools. And again, if you're using those, not a dang thing wrong with those. They've got all your portfolio. The challenge you're going to run into is that how do you quickly and easily reallocate things? How are you going to be able to move on the fly and say, we now have to move all the resources off these projects onto these projects. We have to delay this project. We have to move this project from here to here. So again, whatever tool you might be using, I think I'm going to show you some great capability that you're going to be able to leverage in that. So with that being said, I'm just going to kind of go through some live examples here. We were going to be down at the HIMSS Healthcare Conference. Obviously, as I mentioned earlier, that got canceled along with just about all the other events through August. But when we look at your current workload that you've got going on, now whether that workload is, projects that are in IT, whether those are projects where you're delivering new products in the environment, whether those projects are trying to get new supplies into the hospitals, whether those projects are, in many cases, as we see around the world, working with governmental agencies to supplant the workforce. There's a lot of existing work that you've got going on. There is a finite supply of resources that you're working with. And in many cases, those resources are changing. So whether those resources are now working remote, whether those resources are now not being able to come into work because of certain items, we're going to allow you to be able to look at that portfolio of projects as well as that resources you've got, whether you're looking at things by role or by department or by location or whatever it is. What you now need to be able to quickly and easily say, all right, it's sort of all hands on deck. And so we want to be able to do things like say, we're going to, for whatever reason, we're going to now want to put this project on hold. So let's assume we're not going to get to that one. Let's put it on hold and let's see what resources are going to free up by us putting that project on hold. So in this case, I can see this technology side, I was over allocated. Now I'm under allocated, which is great because now I can allocate that work to one of the other key projects that we've got going on. Some of the other scenario plans or what if modelings that we see people need to do. Let's say there's now a new project that we hadn't planned on doing, and so now we want to know either one, where can we slot it in based on the existing resource profile, and it says, okay, we could kick it off here, and you might say, no, we have to kick it off sooner. All right, we can, kick it off here, but we're going to have some over allocations based on the resources we're saying we need or the generic resources that we've got. And you might say, that's fine. We've got to kick this off. We're going to move this project up. And so now what we're going to end up doing is saying, okay, well, based on that, all these, this is now the new #1 priority project. So we're going to basically take this global CRM and either cancel it for now, or Tempest tell us where we can slot it out to, where we can move it into the future, because we're just not going to be able to get to it right now. So it'll allow you to say, all right, let's move that one out. So in real time, you're going to be able to look at all of the work that you've got, allow you to slip those new high priority projects in, allow you to take a look at your resources and to be able to reallocate those resources, and to quickly and easily know, based on that project portfolio, how you can ensure that you're completing all of those high priority projects to deliver that patient care that you need to deliver, and or get those new products, or say, in many cases, what we're finding is companies that are actually changing over their manufacturing facilities to be able to deliver different products than what they had planned on doing, or delivering more of those products than what they were planned on doing. Some of the other scenarios that we're finding in this arena right now that we're dealing with this kind of black swan event here, is that there are cases where you may find that you've got, in particular, people that either can't get into the office, or they are just not going to be available, as we know. So let's just say, for example, we know that, let's go look here, and we know we're going to have a reduction, and we know Ashley's no longer going to be able to be here. She's home or for whatever reason. And so we want to know real quick what's going to happen if Ashley's not here. And so we can see we're going to have a problem. Obviously, we're going to be over allocated, but that's fine. Let's assume we're not going to have Ashley available. And so now what we need to do is say, all right, we need to now take that work off Ashley. And I'm just going to kind of keep things moving here real quick. I'm not going to go down here, but let's say I'm going to take Ashley, and I've now got to find someone else to do that work who's available that can do that work, right? So we're going to allow you to quickly and easily say someone's coming off, who we're going to be able to put that work on, and give us that real-time answer. And so most of you on this WebEx, think about today how you're doing this. I'm sure you're going through this right now. How are you either trying to do this in Excel, or even if you have a PPM tool, how are you doing these quick what if scenarios in that situation? And so that's really what we're kind of, even us, all hands on deck, working with our clients, and even the clients in particular that aren't using Tempest today, enabling them to get Tempest in up and running very, very fast, so that they're able to leverage this even if they're using another tool, quickly and easily getting this what if scenarios in there for them to be able to allow them to do that. Because as we all know right now, it is pretty much globally all hands on deck, especially in the healthcare arena and in the product development arena, to be able to deliver this stuff. I'll go through some other scenarios here. There are cases, as we know, where quickly, there may be certain projects that you were working on, and you might say, hey, we've got to quickly ramp up doing 3 new or 4 new of these. We didn't think we were going to have to do them, but I need to know what happens if we do 4 more of those very fast. So tell me what that's going to do to my resource portfolio. And so then it's going to let you know where you're going to have your gaps based on doing 4 more of those right away. Maybe that's additional products that you're going to launch. Maybe that's moving, let's say you had a product out here in the future and you need to be able to move it up, and you want to know what's going to be the impact if you move that up. So Tempest will give you the ability to be able to take a look really quick at moving that new product launch up, and knowing what that's going to do to your resource portfolio, being able to move that up in the pipeline there. All right, a few other things I'll do in the what if, and again, I'm primarily doing this to just show you some high level things. As at the beginning of this session, we talked about we can set up some additional WebExes, demos, and or free trials for some of you that are on this crowd here. We're happy to set that up, and we're offering some special incentives, especially for the healthcare companies out there, giving them some free use of Tempus for an extended period of time. Some of you that are doing product development, as you know, you might have already a lot of your products that you've are doing where you've got new products you're launching, you've got various programs, various portfolios, and you may need to say, hey, for whatever reason, I need to put this entire thing on hold. So just assume that we're putting that on hold. Let me know what resources are going to free up if we put that on hold, because we need to move those resources onto another project. Very important. The other thing that we find is that in many cases, we're not quite able to do that detailed scheduling, or if we are needing to do that detailed scheduling, we want to be able to do it in a fast and quick manner. So bear with me, some of these are, was it Estee Lauder in New York? So I know they're not healthcare, but you're seeing some examples here. Let's go down here. Let's go pick this one here. So, but if you did need to do detailed scheduling, so again, for the most part, I've focused on high-level capacity planning, being able to quickly and easily move things around. If there is a need, you do have the ability to do some quick scheduling type of functions. I'm not saying you need to do this. We do have some of our clients that want to do that. So, we're going to have that full capability to be able to do that traditional scheduling you would expect, assigning resources to these various activities. Now, again, in Tempus, we don't require you to do that detailed task management. You might be using another scheduling tool, but that's built into Tempus now. In some cases, a lot of our clients, they might just do that resource capacity planning at the project level. So they might just say, hey, I know I'm going to need Marie for, whether I'm doing it by percentage of time or by FTE or by hours, by quarter, month, week, day. So we're going to let you continue to do that at this level, where you're just, basically allocating your resources in a simple Excel-like spreadsheet. So again, creating those projects, all simple, all easily done within Tempus, at whatever kind of level you want to do it, whether it's at this level, whether you're doing it at a task level, or whether you're doing it at a detailed schedule level. We're going to give you all that capability built in there. But the key criteria is however the data gets into Tempus, whether you're entering the data directly into it, or you're connecting to some external system, or you're uploading through Excel, you're going to be able to have all the power of all this what if scenario analysis available to at your fingertips. And we're finding that more and more that's critical right now in these times that we are in, being able to do that. I don't find a lot. We have some that are wanting to capture actual hours. We even have some that are wanting to do resource requesting process, and they want to get that in place. We have that available as well. But I would say, in general, being able to do this what if analysis is just extremely important and extremely powerful right now. So with that being said, we focused on the scenario planning, data getting in easy. The only other thing I would say is that it's even more critical now to be able to quickly and easily generate high level and or quick and easy reports, right? So being able to look at supply, demand type of views into where we are in our portfolio, being able to generate reports without having to have an expert Power BI person. So, your folks in the hospital, your folks in your product development teams, it's critical to be able to get these kind of things out fast, live, and to be able to make decisions on those. And so Tempest has a very extensive way that you can generate these kind of reports and graphics as we go through those times that we've got, either tabular, where you're looking at how much headcount we're going to need or how much hours that we've got to expend. That's all available here in Tempest. All right. So as I mentioned, we were going to keep this to a fairly short period of time, 25, 30 minutes. The key things that we wanted to talk about today were that very important that with all of the activities that we've got taking place right now, you've got a certain resource set, you've got a certain number of projects you either were delivering or you are going to deliver, and it's critical to be able to do this what if scenario planning, whether that data is getting entered in direct or whether we're pulling data in from an external system. And that Tempest is a tool that allows you to do that. Have a lot of existing clients around the world using it, and a lot of new clients that, frankly, that are coming after us every single day trying to get this implemented like extremely fast. And we have some fast track systems, and we even have some extensive longer than 30 days, in particular for healthcare organizations. So with that, I'll open it up for any questions if anybody has it. If not, feel free to send me an email. And I want to just thank you for your time for being on today. And we wish everybody well around the world and good health to everybody.